Hi, my name is Pooja Patel, and this is my Educated Citizen Portfolio presentation. I chose the topic sexual assault as I was really inspired by the Me Too movement that went viral in 2017. It was really inspiring listening to survivors share their stories and in turn inspiring others to share their stories. Since then, I've become an advocate for survivors and even met some myself personally. One experience I'd like to talk about being an effective communicator was my first semester of nursing school. I was in a nursing home and I remember chatting with one of the residents there. We were having a casual conversation and eventually it took a turn when I realized that my patient was struggling to share some deeper parts of her life. It was not so much what she said, but what she didn't say, that I noticed that she was having a difficult time sharing her story. Because I noticed these nonverbal cues, I decided to utilize nonverbal cues myself and show her that I was really listening to what she had to say. Not by telling her, but by giving her eye contact, my undivided attention, gentle touch. This helped her move forward with her story and trust me. And I feel like this is really important for sexual assault survivors as well. Having someone that they can trust through nonverbal communication, instead of someone just saying, hey, I'm listening to you, but showing you that they're listening to you, empathizing with you, is really important for a survivor. Another experience I'd like to talk about being an effective communicator was when my cousin was going through a difficult time in her relationship and life in general. Over the course of 6 weeks, she would call me every day, telling me how she was struggling to trust her partner, she was having trouble focusing on her school, and managing her anxiety and depression was getting to be too much. However, the only outlet she felt like she had was talking to me on the phone. I talked to her every day for 6 weeks, and eventually she became stronger and felt much better by the end of it all. And this is important, having an outlet for anyone, especially someone who has gone something traumatic, such as sexual assault. For a survivor, sharing their story is something that gives them their power back. Having that outlet, whether that be talking to somebody on the phone, writing it down, painting, doing anything that makes them feel good and express themselves, is going to help them get through the pain and the weight that comes along with being a survivor. Another experience I'd like to talk about being a reflective individual was when I had to transition from the accelerated nursing program to the traditional one. This was a really difficult time in my life because I had this vision of coming to Nebraska from my hometown in Texas and graduating nursing school in 15 months and returning back home to my loved ones. However, 5 months into the program, I realized that it was a little bit too fast-paced for me, and I had to switch to the traditional program. This changed a lot of things for me. I lost that big goal I had, and all my hopes of returning back to my family in 8 months became 2 years. That was really difficult because I had to leave my family, my friends, and my entire life behind to finish out my dream. And it was a lot to adapt to in the beginning. And this is very similar to what a sexual assault survivor goes through. While my story is much more mild, a sexual assault survivor starts off with a normal life prior to being attacked. And then once they become a survivor, they're going through a completely new way of life. They're most likely going to be experiencing a lot of pain, a lot of stress, a lot of trust issues, and finding a way to navigate through this is going to be really important for them. And adapting to this new life that they now live is really important. And whether that is talking to loved ones or sharing their story with other survivors, no matter what they have to do, adaptation is important for them. Another experience that I remember having being a reflective individual was during my first semester of nursing school. We did a group activity as a clinical group in post-conference. Our clinical instructor had us write out 4 names on 4 pieces of paper. And after we did this, she would read out a scenario of our hypothetical life. She would describe the end of our life, how we would get sick, progress, get worse, and eventually pass on. And while she would tell the story of our life, she would take away pieces of paper, signifying us losing some of our loved ones along the way. This was a very emotional experience for all of us, because through the difficult parts of our life that we go through, we tend to lean on the loved ones that we have. And for the most part, these loved ones are the same people that we've had throughout our entire lives. Our parents, our siblings, our best friends, whoever those people may be, they're most likely there for you through the beginning of your life all the way to the end. And hearing that we would lose those people towards the end of our life, even in hypothetical instance, was heartbreaking. And it's so important that this lesson be applied to sexual assault survivors. Leaning on their loved ones is going to be one of the most important things for them, because they're now going through something very traumatic that a lot of people might not be able to understand. But leaning on their loved ones is going to help them get through this new pain and weight that they have in their lives now. One experience I remember being a change agent was when I had a patient who had poor diet habits when it came to her health. She had multiple health conditions such as hypertension, hyperlipidemia, diabetes, a lot of them just overall affected by her bad lifestyle choices. I decided to get to the root cause of the problem as to why she was unwilling to change these habits, so I sat and chatted with her. She talked about how she was very unmotivated because she felt that every time she would try to get healthy, eat nutritious foods, go to the gym, she would revert back to her unhealthy habits because she was frustrated with the society's view on women's bodies. I sat with her and I talked to her about how I empathized with her, because I also was frustrated with the way society viewed women's bodies. It can be really difficult to try to live up to these types of unrealistic expectations, and makes us not wanting to change. However, this is not something that just everyone feels. This is something that sexual assault survivors also feel. When it comes to being a new survivor, you're most likely not going to want to share your story. You're most likely going to be closed off, unhappy, depressed, anxious, and just overall completely different version of yourself. However, it's so important to be willing to get past that and change and find an outlet, find a way to communicate, find a way to live again. Otherwise, it's just going to get worse, and it's going to be a heavier weight in your heart as a survivor. Another experience I remember having as a change agent was when I was in a leadership-based service organization. When I was 18 years old, I was really quiet and shy and closed off and just unwilling to break out of my shell until I joined the service organization. A friend of mine convinced me that I should run for the executive board, and on a whim I did, and I won, and I served, and I made positive change. And along the way, I made a new friend. She would come to my committees, she would ask me questions, and I kind of saw what I saw in myself at 18. I helped her prepare for elections, and eventually she ran, and she won, and she made positive changes for the organization as well. It was really inspiring not only helping her get out of her comfort zone, but watching myself get out of my comfort zone, because the idea of stepping out of our comfort zone is so much more important than anybody realizes. This doesn't relate exactly to survivors, but more to those that survivors lean on. Sometimes it can be really difficult having these types of conversations. If a survivor of sexual assault were to come up to us and tell us their story, we'll probably feel somewhat uncomfortable listening to their story. But as uncomfortable as we feel, the survivor is most likely to feel 10 times more uncomfortable sharing their story. It's very painful. It probably brings them a great deal of anger, frustration, depression, and all of the emotions above. However, it's important that we step out of our comfort zone and grow and help those that are coming to us with whatever that they're going through. Because if we are able to do that, we can help them, and then in turn they can help others, and we create a domino effect of positivity. In conclusion, I learned a lot about my topic. I was always inspired by this movement, especially back in 2017 when it went viral. I was really inspired listening to people's stories, and I always wanted to find a way to advocate for survivors and share their stories and help others along the way. And I feel that the experiences that I've had throughout my nursing education have helped shape me in order to do this as an effective communicator, a change agent, and a reflective individual. I hope to utilize these skills going forward in being a nurse, in being a sexual assault survivor advocate, and just being the person that I am. And I'd really like to thank my school, my professors, for preparing me for all that I hope to become. So, thank you.